Hey, how y'all doing? Happy Sunday. Let me get my sister in here. We're doing Sister Chat. Renee. Inviting my sister on. Hey, Renee. You there, baby?
Hello.
Hi, how are you?
Doing great. How about yourself?
I'm good. I'm good.
Uh,
So we're on with Sister Chat today, where we talk about all things health and beauty. So inner health and outer
that's
health,
right. There you
right?
go. There
There
you
you
go.
go. Exactly.
So we were talking. I remember at the beach, it was interesting how, you think you're reading the right label. You know what I'm saying? So you look for something, it's got it hits all the points. It's organic, it's gluten free, it's all of those things, right? So
Girl.
it looks like perfect. Got it. Take it off the shelf, right? This is a salad dressing. So you figure I'm doing all the healthy things. I'm getting my salad dressing set up. And then what happens to you?
Crazy, crazy. Let,
You see?
let me tell y'all something. First of all, I'm a certified health coach, right? All right. My goal and my passion and my desire is to help all, but in particular, those that struggle with heart disease, those that have a pacemaker like myself, those that really want to do better, but not sure what to do and how, because I was like that. So Renee is talking some powerful stuff. So we go away and I go to get some salad dressing. I always have this one particular salad dressing because I know it works for me, right? But I'm like, okay, I'm reading the label and it's all organic. It has all the fruits and all the veggies that I like. It looks good, but out of all the days, I don't read the label. I didn't read the label. So let me tell y'all something. Reading the label is so very important, especially for us that suffer with cardiovascular disease and high blood pressure. So we're walking on the beach. I think it was on the beach when I noticed it, right? Or we were sitting
Yeah.
down.
But when you were sitting down, it was like, wait a minute, what's going on? You
Yes,
know?
yes, yeah. I think we were outside on the balcony or something. So
Yes.
my feet are swollen like crazy, and I can't even tell you. First of all, I never had swollen feet like that. Okay. The other piece is the ankle part has never been swollen like that for as long as I could remember, and it felt kind of tight, and I didn't quite feel right. So I'm like, what the heck is going on? I said, I'm feeling, relaxed, but why is my feet and I'm feeling the pressure? I go to look at the doggone salad dressing bottle. Out of control. Now remember, when we eat salad, a serving size is um
Two
is
tablespoons for the
two
dressing.
tablespoons of salad dressing. That's a serving size, right? So when I look at the serving, oh, let me tell you, baby, the one that works for me is 10 milligrams. So let me give
Of,
you
of,
a
of
little
what? Of the sodium, right? Of the sodium?
of the sodium. So I'm talking about the sodium right now, right? Because that's my trick bag. That's what I have to be careful of. So I wrote this stuff down because I said I don't want to forget to share this with y'all. So that's what we want to come on today. So salt intake should be about 2,300 milligrams per day. So you say 2,300 milligrams. What is that? That's a teaspoon of table salt. And yes, you heard me, a teaspoon, right? Now, the World Health Organization and the American Heart Association, because I suffer with cardiovascular disease and blood pressure. I have to really control mine with diet, right? As of July 1st, 2020, it says we should have 15 milligrams, right? So that's even less. everything is on sodium. Everything we like tastes good. It
Mm-hmm.
really gets to us, right? So, but then you know why it tastes good? All that doggone sodium they put in it, right?
Exactly. Exactly.
So now so I'm telling you, we should have a teaspoon of sodium per day. But now the World Health Organization, American Heart Association, as of July 2020, that's the latest information I have. It's now 1,500. Check this out. Sodium free is 5 milligrams of sodium per serving. Per serving.
Yeah.
That's sodium free. The salad dressing that really works for me is actually 10 milligrams. I have no
Super.
issues with that.
Mm-hmm.
Very low sodium, very low, listen to me, is 35 milligrams of sodium. So now when we have too much sodium in our diet, that's why it's so important to not only look at the labels, just because it has all that good stuff, all that,
Yeah.
whatever, with the writing that attracts us. We need to really look at the ingredients.
Turn it
We need to look at,
around. Turn it around.
yep, turn it around and look at it, okay, even though it has all that healthy stuff, right? Because these are the things that happen when you have high sodium. You start to feel bloated. That's what I did. You start to feel this, you feel swollen. That's the only way I could talk about it. That's how I felt in my feet and my hands.
Mm-hmm.
And you also get very, very thirsty. And then, of course, the swollen ankles that I had, right, which is terrible for me.
Yeah.
And
Yeah.
as you guys know, I already told you, I got this pacemaker. So now what did I have to do? So with that sodium, that high sodium content that I had, and I didn't even have a full serving size.
No. No.
Yep, because I only put a little salad dressing just so it has a little something on it, so it's a little moist. Because I don't even put the full serving. Thank God I didn't, right? So to flush it out, what did I have to do? I had to drink a lot of water. I had to drink a lot of water with lemon. I had to also make sure I upped my fruits and vegetables so I could try to flush it out,
Yep.
right? So that's what I had to do. So the message today that I wanted to share with you guys, and Renee, I so thank you for bringing this up and suggesting that we talk about that, is don't just go by what's on the label. Turn it around, like Renee said, read the ingredients, and don't forget what got you to your better health. That's what I had to tell myself.
Exactly. Right. That's
What
right.
got you to your better health? What got me to my better health was read the labels,
Yeah.
knowing how much sodium I needed, not just the milligram, because milligrams mean nothing to me. I didn't know what that meant. You had to do some math, do some research. So that's the message today.
Know your target, being able to know your target number,
Hmm.
and like you mentioned, listening to
Excellent.
your body, because our body is wonderfully made, as we know, and so we have to make sure that we're listening to those indications, right?
Hmm.
You talked about the swollen ankle, so that's one indication. Some people, after they eat certain things, they talk about, oh, my hands are itching. Well, your hands are itching could be that you're having a mild allergic reaction to whatever you're eating. And the funny
Right.
thing about our body is that initial allergic reaction, when you first start eating it, it may be a mild reaction. But if
Hmm.
you keep on putting the thing that your body doesn't like into it, those reactions could get more and more serious, right?
Exactly.
People with diabetes, people who may eat something and they don't realize that it's the blood sugar trigger, just like with a person with high blood pressure and stuff, they may see the swelling. People with diabetes may start itching. So itching and different, getting your skin becomes more and more dry because
That's
your
so true.
body is working so hard. So we think about different indicators. So even if we forget to, so to speak, read the label, remember to listen to your body. So then you can backtrack like, whoa, whoa, whoa. What did I have in the last 24 hours that was different? What did I introduce? And when you do that, then you can start like keying in on it.
Hmm.
Michelle, remember when we had that class about looking at a person's face and seeing different parts of their face,
Oh
what it could
yes,
mean? That
yes,
was really interesting. There are people who professionally do that.
yes.
Remember Wendy did that. Wendy, I
Wendy
think
did.
she still does that.
Yes.
Professionally looks at people and can tell because our
Hmm.
body gives us. It's the best indicator, the best
Exactly.
barometer, because you can't go by what Michelle can eat or what Renee can eat. Oh, she can eat that, so it's safe for
Perfect
me.
point. Exactly. Exactly.
May not be
Exactly.
safe for you.
Exactly. That's why I said even with salad dressing, if I don't make it myself, I know that the max per serving for me is 10 milligrams.
Right,
Whereas
right.
for you, that's nothing. You can have 35 milligrams. I can't.
Yeah,
So
yeah.
great point, Renee. Great point. So we hope
That's
this
it.
information was informative and helpful.
Yeah,
And we encourage you that if you know someone that you love and you care about, give them a hand, share the message. Don't keep it
that's
to
right.
yourself.
That's right.
Share the message. That's why even for me and Renee, we're not keeping the message to ourselves. We're sharing the message. So give them a hand,
Yep,
okay? And let's try to get our health back, even if it's just a little bit. All right?
exactly. All right,
Okay.
guys.
Mwah, mwah,
Take
mwah,
care.
mwah,
Bye,
mwah. Love
Juliet.
you guys.
See you.
Take care,
Love y'all.
Juliet.
Bye bye.
Love you. Bye bye. Now let's see how we stop this.